you have given your 100% in this exam. I'm feeling so excited for you all. You finally gotten the time to put forward all the efforts that you had, you all the things that you had prepared. You put it all over there, and it's all connected to all the dreams that you've had, all the big subjects, big branches that you've chosen. And I hope you all gave your 100%. So from what we procured from the students, we spoke to a lot of them, and what I get is a lot of the questions, a lot of the questions in the exam were clinical oriented. They were more conceptual and less based on the facts, right? We have pretty few questions from pedodontics, but they are really interesting questions, all clinical oriented, all want you to apply a lot of logic. Yeah. And very less, I think no factual questions at all of them clinical, all of them require you to do a little brainstorming. So let us begin with the first question that I have got here that came in your exam. And the first question was, a 2-year-old child comes with this particular condition, and what is the diagnosis? So you were given this particular image and they asked you the diagnosis of this child. So undoubtedly the answer here is going to be severe early childhood caries. So severe because, one, the maxillary teeth are completely decayed. There is complete loss of crown structure here. Okay, so there is a complete loss of crown structure, so there is excessive decay there, plus the lower incisors are also involved. So I had told you during my lectures that whenever you see a picture where there are only root stumps in the upper jaw and the lower incisors also seem to be decayed, you have to blindly go for severe early childhood caries. Okay, so it is involved again. Yeah. So it cannot be mild, obviously. Moderate also it cannot be, because the lower incisors are involved and there is no tooth structure here. So for the moderate caries or moderate ECC, you need to have a diagram where there is crown structure that is decayed, there is blackening of the tooth structure, or you can see deep caries over there, but the lower incisors are safe. That then you will go for moderate ECC. But here the situation undoubtedly goes for the answer as severe early childhood caries, right? The second question that was asked is, over expressive parents with neglection of child. So here they've played extremely smart. We've been reading about an overprotective mother, we've been reading about neglecting, rejecting, overindulgent, and all sorts of mothers, but here they have mentioned over expressive parents with neglection of the child. Okay, so as soon as you read over expressive, that means parents who are more expressive, more than required, and that they are neglecting the development of the child. So when you look at the options, overprotective means somebody who is protecting the child, somebody who is governing what a child does and what a child does not, who is deciding for the child. That's an overprotective parent. Neglectful, you know that neglectful is somebody who does not care what the, or probably let's say a neglectful is somebody who does not care what the child is doing, or does not interfere or does not take interest in a child's activities. And hostile is again somebody who is not bothered about what the child is doing or what is being done in the child as a treatment. When you see overindulgent, I told you overindulgent mother or an overindulgent parent is somebody who will do extra for the child. Extra as in, if the child wants one chocolate, the parent would probably say, okay, you keep quiet, I'll get you one chocolate, 2 packets of chip and one fruity also. Okay, so that is something that is overindulgent. A child requires a small cycle, the parent will get a big expensive cycle for the child. So that is an overindulgent parent who is over expressive. and because of that overexpression, the parent is unintentionally ending up in neglecting the development of the child. So when we say over expressive with neglection of the child, undoubtedly the answer becomes an over indulgent parent. They've given the word neglection of the child so that you come directly to neglectful, but that's not the case. When they say over expressive, that means somebody who is excessively giving the child more than he demands, and that is in turn resulting in neglection of the child's development. That's why the answer should be overindulgent. Clear? The third question they had asked was, masochistic habit is which of these? So what is a masochistic habit? It is the one that is self-inflicting or self-injurious. Okay, so these habits are not normal habits. These habits result in injuries to the child, and these are present in children who are not mentally as capable as normal children. They are mentally challenged children. So, out of these, tongue thrusting is a normal habit. Thumb sucking is normal, mouth breathing is normal, but frenum thrusting is a masochistic or a self-inflicting injury, self-injurious habit. So what is frenum thrusting? That means this particular frenum, the labial frenum, what they do, they basically take the labial frenum and in between the two incisors they will lodge the frenum in between the two incisors, and they enjoy doing it. It may result in serious injuries to the frenum getting torn, the frenum getting abraded, but they somehow enjoy doing it. So that's called as frenum thrusting. They thrust or lodge the frenum in between the two incisors, and that becomes a masochistic habit. Is it clear? The fourth question is, 2-year-old child was brought to the clinic with spacing. So where is the spacing? As they say, the spacing is mesial to the upper canine and distal to the lower canine. So what are you supposed to do as a clinician? So as soon as you see mesial to upper canine and distal to the lower canine, the first thing that strikes your mind is a primate space. So what are primate spaces? Primate spaces are naturally occurring spaces that are present in a primary dentition and are specifically present mesial to the maxillary canine and distal to the mandibular canine. So since they are primate spaces and they naturally occur, they are a type of self-correcting anomaly in the primary dentition, and that is why you should do nothing for this child. You should just wait and watch. You explain to the patient that there are naturally occurring spaces in the primary dentition which actually help to align the permanent dentition well. So it is otherwise beneficial to have such spaces, and you must do nothing for these spaces but wait and watch. They are just talking about the primate spaces here. Clear? The next question is, if two stainless steel crowns need to be put in both maxillary primary molars, what should be the sequence? Okay, so for example, there is a first primary molar and then there is a second primary molar, and you've done pulpectomy for both the teeth, that is for tooth number D and E, you've done pulpectomy for both, and now you need to put adjacent stainless steel crowns. So what should be the sequence? So always what you do is the distal crown is placed first and then the mesial crown is placed. That means the second molar is placed first, the stainless steel crown on the E or the second molar is placed first, and then it is placed on the first primary molar. The reason being, when you place the crown on the second primary molar, it helps in establishing an occlusion. The occlusion is established by the second primary molar. So you establish the occlusion by placing the crown on the second primary molar, and then accordingly you adjust the crown on, you place the crown and do the adjustments on the first primary molar. So in order to attain the occlusion first, you place the stainless steel crown on the second primary molar first. Is it clear to you all? The next question that was being asked was, two 11-year-old girls, one attained menarche and the other one did not. So let's say this is the first girl who has attained menarche and the other one has not. Okay, so menarche means beginning of the menstrual cycle. So one has attained menarche and the other one has not. Which one is considered for the functional appliance therapy for mandibular retrusion correction? Okay, so we are supposed to give a myofunctional appliance to these girls. Okay, myofunctional appliance. So which of these will be indicated for a myofunctional appliance? Now, as you all know, myofunctional appliance is given at an age in which the growth of the individual supports the function of the myofunctional appliance. What myofunctional appliance does is it molds the formation or direction of growth of the muscles of the face. Okay, so it is always given in children who are in the growing phase. Once the growth stops, you cannot give a myofunctional appliance because now the muscles are not going to grow. Okay, so now the one that has attained the menarche, that means there is puberty. The puberty has been attained in this particular child. Okay, so now that the puberty has been attained, that means the growing phase of that child is very, very less. So after puberty, the growth pattern almost becomes stagnant. There is very, very slow to no growth after the puberty has been attained. Whereas the one that has not attained menarche, there is a lot of time still remaining where you can use the growth or the growing pattern of the child. So the answer here becomes the second girl, the one who has not begun with her menstrual cycle. That means the one that has not attained puberty. That means she is still in an exponentially growing phase. The growth is not declined, and hence it is always better to give a myofunctional appliance in a person whose growth is supporting the function of such an appliance. So the answer here becomes the second girl. Then we had one more question, that was, a child comes with a pink tooth. So as soon as you see the term pink tooth, there are two things that cross your mind. One, internal resorption. And the second one is pink tooth of mummery. Okay, so now what happens, generally whenever there is internal resorption, the tooth appears to be pink. Why does that happen? Because when there is internal resorption, there is spread of a component called as heme, which is a component of the blood, across the tooth. So what happens, whenever that heme is lying around the tooth for a very long time, there are bacteria such as the streptococcus and the proteus bacteria. So streptococcus and the proteus bacteria, what they do, they come into play, and with the help of the enzymes, with the help of the heme oxygenase enzymes, they convert the heme component into carboxyhemoglobin, and that carboxyhemoglobin basically gets absorbed in various layers of the tooth. So if you section a pink tooth, you will see dark red to brownish pigmentation in the dentine, which reflects as pink in the enamel from outside. So it is basically due to the degradation of the heme component by the bacteria to form carboxyhemoglobin, which reflects as pink color, and that particular carboxyhemoglobin reflects as pink color from outside the enamel when you look at it. Okay, so that is why the answer here becomes bacterial. Okay, so it is because of the bacterial action that the tooth has become pink in color. I hope it is clear to you. Yeah. And then we have, I think, the last question. So we had only these few questions for pedodontics. So the last question is, a 3-year-old child has multiple enamel caries in the front teeth. Which of these restorations would be the best for fluoride recharge? So the answer here is going to be resin modified GIC, that is RMGIC, which amongst the rest of the options has the best fluoride release properties, best fluoride recharge properties. Okay, it gets recharged. So once you do the restoration with RMGIC, every time you do a topical fluoride application, it has the property of getting recharged by fluoride. So that is called as fluoride recharge. Okay, it acts like a reservoir that gets recharged with fluoride, and it keeps releasing fluoride. So the answer here is resin modified glass ionomer cement, that is RMGIC. So these were the questions that we procured for the subject of pedodontics. If there is anything at all, any question at all that I have missed out, please write the question, whatever you remember apart from these, in the comments below, and I am going to post the answer with explanation in the comments. And just analyze these answers, and if there are any doubts at all with the explanations here, again you can write in the comments below, and I am going to clear your doubts there. I hope this was all clear. Thank you so much.